Hello and welcome. You're watching Kaleido Insights video series where we explore the impacts of COVID-19 on key themes that affect our lives as consumers, the future of business, and the ecosystems we are all a part of. I'm Jessica Groopman, an industry analyst and founding partner at Kaleido Insights, and I'm joined today by my wonderful business partners, Jaimy Szymanski and Jeremiah Owyang. We're delighted to have you here with us and hope you are staying healthy and well. The theme we'll discuss today is what we refer to as digital health and wellness, answering the key question, how are technologies transforming traditional healthcare and empowering new forms of human augmentation? Let's consider the future impacts as they relate to the current pandemic that we're in. Now, Jeremiah, from a wellness perspective, what's your take?
Thank you. Speaking of augmenting humans, we're now turning to these devices to make sure that we're well. Now, the wellness space is a cousin to the healthcare space because these are technologies that people, consumers, patients, citizens can adopt without even talking to their doctor. And so that's kind of the distinction between the markets. Now, it comes in four different flavors. We think about our minds, physical bodies, our communities, our networks of friends around us, and then lastly, the physical space around us. And we're seeing a rise of new technologies, especially during COVID-19, where people are adopting these. Let me give you a few examples. In the mind space, many of us are feeling anxiety, myself included, stress, or even depression, or thoughts of even worse things. And we're turning to these apps, mindfulness apps, or chatbot apps like Woebot to talk to an AI bot to get therapy and learn how to heal ourselves. I also spoke to this startup called Wisdo, where they enable the crowd to talk to each other and help each other during times of concern. And then you can in turn help other people. So we're seeing a rise of these mind apps. The second space, the physical body, people are doing fitness. The big winner in this space right now is Peloton. And how do you know somebody has a Peloton? It's easy. They'll tell you, and they'll tell everybody. And the interesting thing is their product is sold out 4 to 5 weeks in advance. And so they launched home apps that you can do calisthenics just from without any equipment. And people are using these to get fit when they can't go to the physical gym or let alone can't even go outside. The next space is people are turning to their community to become well. This is a stat I heard that Facebook group messaging, their video calls have surged 1,000% in the past few weeks since the quarantine. People really want to connect to each other in order to figure out how they can feel better or what is the information out there. Of course, this has upsides and drawbacks. So in summary, this wellness space is growing significantly when we turn to these devices around us in order to try to self-solve, especially when the healthcare system is overwhelmed or at the brink of collapse. But that's my perspective.
Mm-hmm. Yeah, I think it's really interesting, Jeremiah, some of the technologies that you bring up and how some of them are seeing a huge surge right now in particular. I think it's really important to also take a look at how business models are shifting as a result of a more product and service delivery on a regular cadence, otherwise known as the subscription economy, right? There was a recent study in April from Zuora that showed that 23% of companies were actually seeing their subscription growth rate accelerate as a result of the pandemic. So I do think that we'll continue to see a growth, yet I would predict, the next 6-12 months, especially in these new subscription economy subscribers. You mentioned, Peloton is very popular right now and they've seen huge booms in their growth. But I do think it's still up in the air if those subscribers will continue to stay on after some things return back to normal. A different study by Resonate recently showed, for example, that 21% of virtual gym members say they're likely to cancel their memberships over the next few months. I think it's interesting to see how that will shake out. New subscribers versus keeping those subscribers around.
Yeah, it's really interesting across those four areas how both technology and just back to basics have become sort of critical in terms of our own wellness. We're turning to our friends and connection, but using digital technologies. We're trying to keep up with our own immunity, our own mental and physical fitness with technologies and without. And of course, trying to optimize our spaces, our shelters as much as we can, both with technologies, but also just with quiet time and what we need at sort of the most basic level. Now, turning to the healthcare side, Jaimy, what are you seeing as some of the biggest impacts there?
So it's interesting because many of the therapies and trainings and tracking of elements of modern wellness and well-being that Jeremiah has discussed require, I would say, a consumer acceptance of a new way of receiving products and services, as well as receiving care from their healthcare providers. Sometimes this is referred to as a digital-first method of delivery, or otherwise referred to as telehealth. So as a result of COVID-19, as well as this relaxed enforcement of HIPAA privacy and security enforcement and penalties, we're really seeing this boom in telehealth that is widening to include, yes, these forms of wellness, but also more diverse forms of healthcare. I mean, people are meeting with their primary care providers via their iPad or via Skype. We're checking in with therapists over text message. We're looking at fitness classes on Zoom, for example. So that growth is dependent not only on consumer adoption, yes, and also the collection of biometric data, which is a completely different topic for a different day, perhaps, but also ecosystem partnerships that require data sharing among healthcare providers, doctors, clinics, insurance providers, and again, even personal data as well. We're not quite there yet in examining the data side and the back end of the healthcare ecosystem. Last point here, too, I also think it's worth mentioning when looking at the healthcare space that a surge in telehealth will also require new cost structures, as well as really examining the difference between the cost of care and the efficacy of it, right? So just because it may cost less to see a patient using telehealth interfaces, just because it's less overhead for the doctors and whatnot, and in the clinics and maintenance, that doesn't mean that it is still the same quality of care. So what happens to bedside manner when you can't interact with your care provider in real life? I think that some of those impacts are yet to be seen.
Thank you, Jaimy. I recently had the chance to interview Jeff Immelt. He's the former CEO of GE, and as you know, they make a lot of the healthcare technologies. And I kind of just want to summarize what he said. He said when it came to digital transformation, the healthcare companies went from business plans of years down to weeks. They're forced into it. And those that were already digitally able were able to quickly maneuver and make those changes. One point, an example, I also spoke to a product manager at Amazon Alexa, and they've been rolling out the Alexa Show product, which is the device that also has a camera, into New York hospitals. So the patients could communicate directly with physicians and nurses in another room. And this way, the medical staff did not need to don up the personal protective equipment and then throw it away immediately after. And so they're able to have this real telehealth, but just from a few feet away. And because of that, that was the need. They actually saw that HIPAA regulations were relaxed and softened in order for them to be able to do that. So your questions around data and privacy and connecting and telehealth, I'm definitely seeing those examples.
And it's fascinating how companies, both traditional healthcare companies, as well as in many other industries, including in industrial applications and so forth, are sort of thinking about resiliency, thinking about how to incorporate health, sanitation, safety, public health into their long-term business strategies, well, near-term and long-term. We talked a little bit about this in our prior discussion around digital trust, but this notion of public health as a business and technology strategy, distinct from kind of core efficiencies or scale, as we've seen traditionally, begins to incorporate new interfaces of technology because in many ways it's simply more safe or it's more scalable in terms of resilience, being able to quickly pivot a factory environment to produce more ventilators, for example, or to productize data around potentially cross-skilling different employees to have skills in both sort of health and safety, as well as in maybe a core business competency. But from the technology, the interface side, what I think is fascinating is, when we think about technology interfaces, we of course think computers, we think mobile, maybe we think of Fitbits. But in many ways, the entire notion of digital interface is expanding across the world. Just as to take an example of how this relates in healthcare, robotics. Robotics, we are now seeing examples in drones, in robots being used for sanitization or to spray, sanitizer or aerosol. We think about intelligent cameras as a digital interface. These are not just cameras, collecting video feed, but they're actually analyzing the subjects, the objects, the people in their field of view. We just saw an example a few days ago of an emerging application that detects blood pressure and heart rate variability through the camera. Think about something like augmented reality, another new interface. We're seeing a rollout of augmented reality enabled glasses in China in order to detect temperature of passersby. Remote training, of course, for health workers to enable and extend their abilities to do new tasks, but doing so safely through augmented reality. We touched on biometrics, of course. This in and of itself, our biometrics are an interface for how we emit our own health, and also how our health is and will be our health, our immunity, whether we're positive or negative. All of these different aspects is something that are derived from our biometrics. We're also seeing an investment in touchless or contactless payment or portals, again, around public health, to keep less individuals exchanging money or cash and rather have something that is simply uses a sensor or a point of sale payment mechanism to uphold that safety element. Call centers have been used extensively right now as a method to relieve some of the pressure on in-person exchanges. Mobile devices, IoT sensors and wearables. There are just so many different kind of applications for how we are using devices and sensor data, and in particular, the analytics that comes off of that data in real time to better manage safety, to better manage health and understand our health. And particularly on the mobile side, obviously much ado about contact tracing. We'll see how that shakes out here.
Mm-hmm. All these different sources that you're talking about, Jess, I can't help but think about how this will continue to mobilize the potential of population health as well. Being able to understand massive amounts of public data in aggregate and analyze that data to better understand the health of a community versus just the health of a segment or of an individual. That's kind of the holy grail in terms of using data at an anonymized level and combining it with secure infrastructure on the back end. Typically what we're seeing now is people are using various forms of cloud infrastructure in order to store the data securely in an anonymous fashion, and then being able to put that AI layer on top in order to assess the health of an entire community or a region and how diseases spread, which directly relates to contact tracing, which I know, Jeremiah, you have some thoughts on as well.
Yeah, so contact tracing, if you're not familiar, the manual way is if somebody's sick, somebody will physically interview you, often over the phone, to find out where have you been and what are your symptoms. Now that's becoming digitized. Prior, I mentioned the three areas: mind, body, community, and space, but I didn't really talk about space. So I was waiting for this opportunity. Now, the way that digital contact tracing apps work is you can opt in to download an app, and as you're moving around the world, it'll send secure anonymous keys with other phones who also have that app. And if for some chance, let me just give an example. Jaimy, you and I meet up for coffee, and we both have the same contact tracing app on. Those apps exchange the data that we met, but it's not the personal information in most use cases. Later, maybe I got sick, hopefully not, but then I could emit a signal if I choose to be a good citizen and let everybody who I came in contact with out the physical space and world that I was with them. And it's looking for durations of 10 minutes. Now, the leaders in this space have been Google and Apple, who have made a promise to do this, but the production has slowed down. There's some questions on how effective it will be. We also heard there's some open source versions that are very focused on privacy. I met with one group called Coalition. And we also see that governments are starting to adopt these. MIT and Massachusetts, the state, are also working on how they can roll this out. Of course, this leads all kinds of questions around privacy, and European countries are struggling. Should the data be local? Should it be on the phone? Should it be deleted? How long will this last even after the pandemic? Which pandemic? We have COVID-19 now, but we might have COVID-20. It's by year, by the way, at the end of this year. We just don't know. The last thing, I call these apps herd intelligence. You've heard of herd immunity, but this is to really understand how the whole community is and how successful they are. But here's the one restriction we have, or limitation with this technology, is I've read the stats that you need 40% to 70% of the herd, the population, to have these apps on for it to truly be effective. So is this going to work? I'm not sure yet, but we'll see.
We'll see indeed. Like so many areas, this pandemic has accelerated some of the existing trends. And as a firm, we've been tracking digital health and wellness for years now. And in many ways, this really accelerates the technology applications, introduces so many new interfaces, so many new, not just telehealth, but teleservices involving health, public health and safety, and of course, contact tracing and beyond. You guys, thank you again. This was a great discussion. Thank you, Jaimy. Thank you, Jeremiah, for your insightful contributions. You can learn more about Kaleido Insights, digital health and wellness coverage, and our other research themes on our website at kaleidoinsights.com. And join us next week as we continue to analyze how COVID-19 will impact the future in the area of ambient computing technologies. Thanks for watching.
Thanks. Bye-bye.
Bye-bye.